Listener discretion is advised. Welcome to a very special episode of Coffee and Bottles with Nathusha and Adriana.
Low, they were definitely lying because I never had a glow.
The glow is just the sweat, Adriana.
Yeah, exactly. Okay.
I think I can talk all about pregnancy and how much I did not enjoy it and how much I hate acid reflux and I still have it now.
Mm-hmm.
And yeah.
You know what was really interesting though? I hated it the first time as well. And then the second time, it was it was just so different. Different. Yeah. At one point, I was just like, holy cow. Just with my first, it was a lot of nausea and just constantly exhausted.
Oh no.
Exhausted.
Yeah.
Even though during the day it didn't really feel like that, but once work was done and whatever, then it was just woof, everything just hit.
Yeah.
And plus it was, my first, so I was just okay, I need to listen to everybody and put my feet up and, do all that stuff. With the second, it was I can just continue doing stuff. I can
No way.
My life. I don't have to, be a bucket or, garbage can to be classy, I guess. But, I don't think but it was just so different. There was no more nausea. I mean, there was a little, not that much.
I would. Oh, that sounds heavenly.
Yeah. Yeah, definitely.
I remember that I did not have an appetite for most of my pregnancy. I would just have heartburn or vomiting, something. It was gross.
I remember that. For the first, it was maybe 6 months out of the 8, because I was induced early. So
yes, yeah.
Out of 8, I was nauseous and heartburn every night, and just it wasn't amazing.
It wasn't fun.
But the second was great.
Well, that's good to know.
Yeah.
It's great to know. Maybe one day when we have our second.
Yeah, there you go.
It could go either way. It could be worse or it could be better.
I know.
Anna. Hey guys, so we decided to do things a little differently for this episode because, I'm sure you've realized by now that we like to interrupt each other a lot. So we've recorded our stories separately. Okay, so I had a miscarriage the first time I got pregnant, and that was tough. Not something a lot of people talk about, but it is apparently very common, but nobody really wants to talk about it. For me, it was hard because it felt like it felt like it was something that I had done. It took us some time to get pregnant again, and my dad's cousin told me about acupuncture, which worked for her. So I booked an appointment, and she told me all about the different nerves and how even the nerves on your foot can affect the rest of your body. I had no idea, so we gave it a try, and after a few sessions, I was expecting. The first time I was pregnant, I had morning sickness for about 3 or 4 months. I just felt sick all the time. My family member's coworker told her about keeping crackers and dry food beside her bed at night, and her advice was just to keep snacking and never let yourself feel too hungry. But this was tough because at my old job, I couldn't snack all the time and had to wait for my breaks. But luckily my coworkers were all so lovely and definitely understand or remember what it was like to be pregnant, so they were always very accommodating. We decided to take a trip to New York with one of our couple friends, and it was a very hot summer. Well, anyway, I decided to try out one of those bracelets made to help with seasickness, and it actually worked. Or it could be that the morning sickness had gone away. Either way, I was thrilled it worked. I had also tried ginger candies that my dad's cousin suggested, and she even bought me a few. It worked for a while, so that was pretty helpful. The second trimester was when I started to get really, really itchy on my stomach, to the point where I would wake up in the middle of the night just to scratch. I talked to people about it, and they all said it was normal, but luckily I mentioned it to my doctor, and she said that it could be something called cholestasis of pregnancy. Well, I think it's called intrahepatic cholestasis of pregnancy, but that's way too long. She said she wasn't sure, but we should get a test done just in case. FYI, if you think you have this, you will have to pay to get the test. So sure enough, test results came back, and it was cholestasis. So what is that? It's when you have a buildup of bile, and it affects the way your liver functions. If untreated, this can cause preterm birth or even stillbirth. Keep in mind, that is something that many people don't even know that they have until it is too late. That's why it becomes so dangerous. When you are in your 30th week of pregnancy, you're still alright. But when you reach 37, it starts to spread in your system and could prove a high risk to your unborn fetus. This is why I'm advocating for awareness of cholestasis, because it is too late if you don't know and presume that it's just a normal pregnancy. That's why I had to be induced at 37 weeks. Being induced means they make your body feel like it is in labor by giving you some drugs that cause cramps and contractions. For me, they gave me a gel and then waited until I started to dilate. They sent us home until I eventually started to get some cramps. So when I had dilated about 2 centimeters and was having some cramps, which I thought were contractions, we were told to check in at the hospital. But they didn't have enough beds, so when we were told to walk around for a while, it was a little bit nerve-wracking. When we got a bed and I was having contractions, I got an epidural. It wasn't bad. I just closed my eyes and then I didn't feel anything. But when I got a contraction, it felt like something was pushing down on my stomach. So that's when they told me to start pushing. This is the time where I need to thank yoga. If I wasn't doing yoga at the time, I would have had a really tough time breathing through the pushing. It is important to push with control, if you can believe it, because I was in active birth for about 30 minutes. Then once it's all over, we found out that baby Elsa had jaundice, which is the yellowing of the eyes and skin, so she had to be incubated with UV lights until her levels were lower, and she was given the okay to be discharged from the hospital. Unfortunately, it took a few days, and because I was learning to breastfeed, the hospital staff were so kind that they let me stay overnight, so that I could continue to feed her as well as supplement with formula. My body was not quite producing enough milk yet, so it was important for us to do that. So, I remember one day Papa came to see us during visiting hours, and there was a baby in the next room who was also being incubated, and I remember hearing the poor father being so stressed about going to Costco before they brought the new baby home, and the mother just wanted to go home and take a shower. So yeah, once her levels were lower, we had to see our family doctor to confirm that the levels were low enough that she wouldn't need the treatment anymore. And wouldn't you know it, it was not. So back to the hospital we went. Our doctor actually told us to go back to the maternity ward and go to the clinic that is up there. But for whatever reason, we went up there and we were told to go straight to emergency. So we went to Emerge with like a 3 or 4-year-old. And thankfully, a lot of the hospital staff were really nice and tried to help us get through the process quickly, because everyone was like, you guys should not be here. So once it was all said and done, we were finally able to see the doctor, and then she had to be put under the lights again. Poor girl, she kept getting her toes poked just to check her blood and check the levels. I'm not one that's very squeamish, but I couldn't watch them do it so many times. But yeah, so then her levels were good and we were finally able to go home. Now putting her into the car seat, that was a whole other story. So when Anna was born, it was a totally different pregnancy. I didn't have any morning sickness, no nausea, nothing. Because I had cholestasis with both girls, I was actually monitored very closely. So when I went to one of my appointments, I actually had to go straight to the hospital. So when I got to the hospital, I was once again induced, and this time I feel like the process went a little bit faster. Also got the epidural and pushed for not very long, maybe around the same 30 minutes or so. And Anna was born. And she actually did not have jaundice. My husband and I actually had to ask the nurses like over and over, are you sure she doesn't have jaundice? Are you sure? And they were like, yeah, you can go home. So it was kind of funny because the second time around, before we went to the hospital, we actually went home quickly, and like I just grabbed the overnight bag that I overstuffed with things because the last time we stayed for so long. So one thing I want to quickly mention is our oldest actually was under 2 when our youngest was born, and it was a little bit tough for her at first to understand the whole concept, so we started reading a lot of books about having a new sibling, and we watched some shows or clips like Daniel Tiger about having a new baby in the house. So one thing we did that I find worked really well, and I either heard about this from someone or read about it somewhere, but we actually got the girls, like both the older one and the younger one, to exchange gifts with each other. So our oldest one gave one of her old toys, like a toy that she thought the baby would like, and the younger child actually got her a new toy, that one that she was really excited about at the time. So I thought that was really interesting because I feel like that really helped the two girls understand what was going on. And yeah, those are both of my birth stories and a little bit of my pregnancy stories. Over to you, Mithusha.
Hi everyone, it's Mithusha, and this is my pregnancy and birth story. Now, my pregnancy story started after 3 years of fertility treatment and unfortunately 1 miscarriage. Our miscarriage was heartbreaking. As often as it happens to couples that are trying, it wasn't easy dealing with it. It took us about 3 years to actually conceive, and then finally I was pregnant, and then in a short month and a half, baby was gone. It was devastating, and we were doing a treatment called IUI at that time, but after the miscarriage, I really did not want to continue that route, and I wanted to go straight into IVF. It was my husband who encouraged us to try one more time. And I had the procedure, and then the next day I decided to book an acupuncture appointment, which I've never done before. And lo and behold, I got pregnant again, and Mowgli was conceived in November of 2018. And he was the result of a 4th IUI procedure. To be honest, if my husband didn't push us to do that procedure, I don't think we would have little Mowgli today, or we would have probably had to wait a little longer for him. So thank God for that. Now, in the beginning of my pregnancy, it wasn't too bad. I had very little morning sickness. But I did have acid reflux that resulted in coughing fits and then eventually led to vomiting. I know, it was pretty glamorous. I was quite tired in my first and second trimester, but surprisingly quite energized for my third. And during my pregnancy, like I mentioned, I had horrible acid reflux that led to coughing. And then I also had a runny nose, and my allergies were heightened, and my asthma was heightened. I just want to say thank God for my doula. She's also a naturopathic doctor, and she helped with dealing with all of those symptoms. But pregnancy wasn't all bad. In the 5th month of our pregnancy, we had our baby moon in the Bahamas. For those of you who don't know, a baby moon is the time you take with your spouse before the baby comes. Sort of the last hurrah with you and him. That was a great trip. We actually found out the gender right before that trip. Well, my husband did. I wanted it to be a surprise until we had our gender reveal, which was actually on the beach at the resort. We popped one of those big black balloons with, the question mark on it, and blue confetti came out. It was very exciting. And yes, it was on the beach, but don't worry, we cleaned it all up. Now, Mowgli's birth story starts in the morning on July 26th. I woke up and noticed what you call the bloody show and thought, okay, I'm going to give birth soon. I didn't know how soon, but I knew it was soon. I told my husband, and he asked if he should stay home, and I said I would call him if anything, because I thought, okay, it's going to take me a while. So I head to the washroom, I shower, and around 10:30, I had my first contraction. I called my husband, and he was already halfway to work, and he turned right around, came straight home. My contractions at first were random, and I called our naturopath. Well, he called our naturopath, and she said she would come over to the house. But they were speeding up, and we decided to head straight to the hospital. So we called her and said, can you just meet us there? When we first went, I was only about 2 centimeters dilated. So the nurse asked if we wanted to walk around or go home and come back. I said I wanted to go home because I thought, it's my first baby. It's going to take quite a while. So in rush hour Toronto traffic at 3 p.m., we decided to head home. While we were heading home on the highway, my contractions went from 5 minutes apart to 2 minutes apart. Screaming that I wanted to go back to the hospital, my husband got off our exit for home, grabbed something at Tim Hortons because he knew I wouldn't be able to eat once I'm in the birthing suite. I took one bite of the sandwich and I couldn't eat anymore. It also felt like forever for us to get to the hospital. Again, it was traffic. Once we got there, I went straight to the washroom and basically purged everything that was in my stomach. They got a robe on me. I sat on a wheelchair and I was in the middle of it, I would say, like very bad cramps. And I got rolled into the birthing suite, and on the way there, the nurse asked me, she's like, do you want an epidural? And I was hoping for a natural birth. I said, yes, please. I would like that epidural. And once I got it, they were like, you know what? The contractions should slow down a little bit. And I didn't feel that much pain. It just felt like a bit of pressure in the pelvic area with each contraction. Now, I was very lucky because by that point, my naturopath was at the hospital and she was actually giving me a bit of acupressure for every single contraction that I was having. And it helped quite a bit because I would feel a bit of pressure, but then I would actually feel no pain at all. Like I mentioned, epidural slows things down in labor, and I didn't know that at that point. So after I had it, Mowgli's heart rate actually dropped quite a bit, and they couldn't find it. So there was panic in the birthing suite. There was a few nurses, one doctor, and they were kind of moving me around and trying to find his heart rate again. Eventually they sprayed something in my mouth and then his heart rate went back up. And that was incredibly scary, but I kind of forgot about it. I'm like, okay, he's good now. It's great. Time goes on. It's about 6 p.m. and my naturopath's like, oh, we thought you would have had the baby by now. And then time goes on a little bit more, and around 8:30 or 9 p.m., my nurse put something into my IV. I'm like, what is that? And both my naturopath and we look at her and we're like, is that Pitocin? Which is, it's like, it's supposed to help with the contractions to speed things along in labor because I slowed down so much. And she's like, yes, it is. She's like, the doctor recommended it. We're like, okay. So once that happened, again, Mowgli's heart rate dropped and we couldn't find it. And they were looking around and, there was the doctor that came in, and then there was also the doctor's teaching assistant, I guess, or resident came in as well. And there was a few nurses in the room, and all I remember is panic on my side, but they started putting on their surgical masks and gloves, and his heart rate came back up again. And it was crazy because I thought, okay, good, he's back. I'm gonna push him out, like it's gonna be a natural birth now. But they actually recommend that I have an emergency C-section because there's a high chance that it will happen again. So we had an emergency C-section. He came into the world around 10:30 at night, and he was 7 pounds 2 ounces. So that is my birth story. What I would recommend is always have a birth plan, and always ensure that you give your birth plan to the nurse, because that's something that I forgot. And I would highly recommend a doula as well, because she, with everything that was happening and all the panic in the birthing suite, there wasn't a lot of communication coming from the medical team at that time because they were too busy doing things and trying to help. My doula was there to explain things to me, and I greatly appreciated that. So if you're able to do it, definitely get one. Thanks, guys. Bye.
Follow us on Facebook and Instagram, and feel free to tag us at #Coffee and Bottles Podcast. Thank you for listening to Coffee and Bottles. Keep sipping on.